Well, the big health care reform proposal has made it out of the Senate Finance Committee, but it's still got a long way to go before it ever becomes close to becoming a law. Senator Mike Crapo is a Republican member of the Finance Committee, and he joins us now live to discuss the long road ahead. Welcome, Senator. Thank you so much for your time.
Thank you.
Well, tell me about this. We have two major bills now going through the Senate. How did they come together? What's the process? And do Republicans have a seat at that table?
Well, no, the Republicans don't have a seat at that table. And as you may recall, the bill, which was actually just a concept paper that we voted out of the Finance Committee, is now being merged with the bill that was written in the Help Committee when Senator Kennedy was still alive, and is often called the Kennedy bill. Those two bills will be merged, and we'll see something come out in the next 2 to 3 weeks that we will see go to the floor of the Senate. We don't know what it will be, but we expect that it will move to the left of what the finance bill was.
And we've heard a lot made of the fact that the CBO score on the finance proposal was $829 billion. But then this week on the floor, we heard Senate Majority Leader, Democrat Harry Reid, say $2 trillion. What's the real number?
Well, the real number is closer to $2 trillion because in order to make it appear that the bill balanced and that it actually didn't drive the deficit up, they had to do some number games. And so what they did was, this is a score over a 10-year period. They delayed the implementation of the spending parts of the bill until 2014 so that they only had 6 years of spending in the first 10 years. And all of the revenue measures were kicking in from the outset, and so then they could say it was only $829 billion. The real true 10-year picture at 10 full years of the bill is closer to about $1.8 trillion.
Okay. Now, another contentious part of this whole process has been the public option, a government-run option. Of the 5 bills we have on Capitol Hill, 4 include that. Do you think we're going to end up with one? Because one of your colleagues, Senator Specter, said on Fox News Sunday today he sees growing momentum behind a public option.
Well, I think that's wishful thinking on Ireland's part. The fact is that I think the public very clearly does not want government-run health care, and that's exactly what a public option would bring us. And we can debate over what will or won't be the end result of a government option, but when the government takes over the delivery of health care, decides what products can be provided, what the price for those products will be, and then is subsidized by the taxpayer, all the studies indicate that what would happen is eventually they would push the private sector aside and move people into that public sector. And frankly, that is one of the major objectives of those who are seeking to have a public option. I think the likelihood is that it just can't make it through the Senate, but they're doing everything they can right now to dress it up in every way that they possibly can. And frankly, they've got some troubles because in the House, I'm not sure that it can make it through without being in there. So we'll have some interesting politics for the next 2 or 3 months probably.
And we know you're very busy, so thank you for taking time out of your schedule today and for joining us in the midst of the Bloom Boy drama. Thank you for sticking around, Senator Mike Crapo.